Hello everyone, my name's Catherine Moore and I'm a reader based at City St George's in the University of London. I'm a reader in global health and infectious diseases, and I've been in City St George's for just over 2 years now. I have a PhD project looking at the prevalence of antimicrobial resistance and antimicrobial use in patients with bacterial infections, and looking at this prevalence of resistance over 15 years between 2010 and 2025, and the interactions between the resistance and demographic indicators and climate change globally. My co-supervisors on the project are Dr. Naomi Waterlow, who's based in epidemiology and public health at the London School of Hygiene and Tropical Medicine. Her focus is looking at mathematical modelling in antimicrobial resistance, and Professor Charlotte Brown, who's a professor of epidemiology in the Population Health Institute here in City St George's, and her work has really focused on environmental impacts of things, of different things to health, and we bring together a real expertise in antimicrobial resistance, modelling, and the intersection with the environment. And the project that we have really expands some of the work that I have on a UKRI funded grant, looking at the causes of diseases and bringing this together with AI. We are really trying to understand the importance of demographic information such as age and sex, and how this drives higher levels of antibiotic resistance, both in Europe but possibly globally, based upon the availability of data. But really we're trying to look at the holistic nature of antibiotic use, antibiotic resistance, together with that demographic information and climate change on the possible change of antibiotic resistance. And we're looking at this 15-year period, so from 2010 to 2025, to try to provide unique insights into future interventions, particularly thinking about low and middle income countries where climate change will probably have the highest impact. We're looking to expand some of the work that Naomi has been doing with Gwen Knight in the London School to understand that intersection between AMR and age and sex, but also to bring in Professor Clark's work on environmental exposures and climate change. And we have some data from the European CDC, some data from the WHO GLASS database, and we can use data from the NHS hospital within City St George's to really start to understand the relationships between age, sex, climate change, antibiotic resistance, and antibiotic use. There is some data also available from the CLEVER cohort, which looks at living environments and health in children in the UK. We very much hope that this project will excite some of you who are interested in antimicrobial resistance and antimicrobial use, and interested in looking at the impact of antimicrobial resistance and climate change, and how we may be able to do some modelling to change some of our discussions around antimicrobial resistance and how the burden of resistance is going to change over time and space over the next few years. Please do reach out to myself, Naomi, or Charlotte if you want to discuss the project. Thank you.